Hello everyone, my name is Dr. Kamal Makbul and today I will be talking about thyroid cancers, myths and facts. So let's begin. So thyroid gland is a butterfly-shaped organ that lies at the base of your neck. It has got two lobes and it lies on either side of your windpipe, connected through a tissue known as the isthmus. Let's talk about the functions of the thyroid gland. It releases the hormone T3, T4 and calcitonin which has different functions on different vital organs in the body. The heart, digestion, brain development and nervous system, bone health, muscle contractions. The calcitonin itself has a function on the bone health, kidney clearance rate, parathyroid hormone production. The need to talk about thyroid cancers and busting out the myths, I feel, is really important. I used to work in a thyroid setup where most of the cases were of thyroid cancers and they present really late. They had got such huge swellings which made it really difficult to do the surgical intervention, and some of the times the cases were very difficult to treat. When inquired such patients, we always end up getting the same response, that is the misconceptions. Sometimes they used to have the misconceptions of being intervened will spread their cancer, or these cancers are not curable, and so much more that we will talk about in the video. Let's begin with case 1. This was an old lady who presented with this swelling in her neck for more than 10 years, which gradually increased in size, and when she presented to us, she was having symptoms of breathlessness. As she belonged to a rural area where it is a common concept that if you intervene such a swelling, the cancer will spread throughout your body, unfortunately, they have no awareness about this disease and end up having long-term complications. Coming up the picture of the swelling, this is how bad it was. It was so large and so extensive, but was luckily removed safely without damaging underlying structures. Alright, so let's take up the second case here. This was another lady who had this huge thyroid swelling which started 30 years ago, but she did not seek medical attention due to the same misconceptions and myths she has heard about these swellings. She presented in a really bad condition and was in severe respiratory distress. This might be a little disturbing, but I have to share the picture for awareness and to understand the importance of these swellings. So this is the swelling. This was so enlarged and this has been gradually increasing for the past 30 years. And this was the thyroid gland removed from this patient. What is thyroid cancer? Thyroid cancer is when the cell starts to divide uncontrollably and it leads to formation of nodules in your gland which will increase gradually in size. The presentation of a thyroid cancer can be a swelling or lump in your neck which is usually painless. It can be hoarseness of voice. It can be sore throat or difficulty swallowing. Let's talk about the risk factors. It can be an inflamed thyroid or goiter. It can be a positive family history of thyroid cancer. This states to be a very strong risk factor for developing thyroid cancer. Exposure to radiation that can be in your childhood, obesity, race, which is Asians and white people are more likely to suffer from thyroid cancer. Then we have familial adenomatous polyposis. This is a bowel condition which affects your gut. Then we have breast cancer survivors, which a study shows in these people thyroid cancer can develop. And then we have a rare condition in which the body produces a lot more growth hormone which leads to acromegaly. Treatment of thyroid cancer. It depends on the type of thyroid cancer you have and how far it has spread. It can be done by the following options, like surgery, in which partial or complete removal of your gland will take place, radioactive treatment, in which a substance will be given to kill the cancer cells, external radiotherapy, in which a machine helps with radiation beams to kill the cancer cells, chemotherapy, and targeted therapies, which are medicines that are used to kill the targeted therapies. So these are all the treatments for thyroid cancer. Talking about the type of thyroid cancer, we have papillary, follicular, medullary, and anaplastic. The most common ones are papillary and follicular, which have a very good prognosis, and the most aggressive form of cancer in thyroid is anaplastic cancer. When we talk about the papillary cancer, 8 in 10 cases are found to be papillary, and it usually affects people under 40 years of age, while the follicular is 1 in 10 cases, and it affects particularly women. According to the statistics, in females the prevalence is 1 to 5% of thyroid cancers, and it is considered as the 7th most common cancer in females, while in males the prevalence is 2% and 14th most common cancer in males. Let's begin bursting out some myths about the thyroid cancer, and let me tell you about the facts which are real related to thyroid cancer. It is a common myth that middle-aged and old women will have this disease. But the fact is, both males and females can develop a thyroid condition at any age. 1 in every 5 women develops thyroid problems by the age of 60. Thyroid disease may affect your fertility, pregnancy, or postpartum months. Another myth is the best diagnosing method for thyroid cancer is by identifying symptoms, which really is not true, because about 60% of the patients do not have any symptoms. It's a common myth that thyroid cancer is a good cancer. But let me tell you, there is no such thing as a good cancer. Like all cancers, thyroid cancer can also be potentially dangerous, and timely management is necessary. Another myth is thyroid diseases or cancers are easy to treat. But the fact is, it is a complex disease, and different cases need different approaches for successful diagnosis and management. Another myth, if you have a thyroid nodule means you have cancer. No, the fact is only 5% of thyroid nodules are cancerous. Another common myth is, if you are suffering from thyroid problem, you will develop goiter. But no, majority of the thyroid patients do not develop goiter. Goiter, as I told you earlier, is swelling of your thyroid gland in your neck. Another myth, old people are only at risk of developing thyroid cancers. No, the fact is thyroid cancers can be present at any age. Around 2 to 3rd of the cases are found in people aged 20 to 60 years. Another myth found related to diet and thyroid diseases or cancers is cruciferous vegetables harm the thyroid. But the fact is, it is a big misconception that certain green vegetables increase your risk of thyroid disease or thyroid cancer. But like other cancers, they have mild protective effect of preventing the thyroid cancer. Another myth is, I will not lead a normal life after surgery. No, you will be able to live a normal and fulfilling life without the thyroid, or a part of the thyroid if it's removed. You will be able to do everything you used to do prior to the surgery. I only need to be screened for thyroid cancer if I am above 50 years. No, let's burst this myth as well with the fact that if you have any risk factors or family history of thyroid disease, you need to be tested earlier. Benign nodules are safe and will not cause any issues. The fact is, benign nodules can also cause issues if they grow large and obstruct the throat, or if they stimulate the thyroid to overproduce the hormones. I am under 40 and I do not need to worry about thyroid cancer until 50 years of age. Let me tell you, thyroid cancer has the highest incidence in young people. Thyroid cancer is not curable. Unfortunately, this is the most common myth I have found in my patients, in which they think the swelling they have in the thyroid or in their neck is not curable. And if it's cancer and somebody intervenes, it will spread. But the fact is, most cancers of the thyroid, if detected early, are easy to cure with surgery and radioiodine therapy. In general, a common cancer of the thyroid have a benign course when compared to other cancers. So in a nutshell, around 9 in every 10 people are alive 5 years after a diagnosis of thyroid cancer. Many of these are cured and will have a normal lifespan. Thyroid cancer is usually treatable and in many cases can be cured completely, although it can sometimes come back after treatment. It is most common in people in their 30s and those over 60, and women are 2 to 3 times more likely to develop it than men, but that doesn't mean that men are safe. Timely evaluation and management can save lives. Saying that, I hope my video have explained about thyroid and thyroid related cancer well to you, and now you have got quite an idea and awareness about thyroid cancer, its myths and facts, and how timely evaluation and management can save you and anybody suffering from thyroid cancer. You can look around and aware the people, family and friends and advise them to get timely evaluation for this disease. Every year September is celebrated as Thyroid Cancer Awareness Month, and I hope this will help you get some awareness about this disease. Thank you so much.